you very much for joining us. We are on Thursday, October 15, and our press briefing is on COVID-19 situation update in the WHO European region. We welcome all journalists who are watching us on Zoom, but also everyone who is following us on Twitter and Facebook. Before we start, let me just stress once again that the journalists who want to ask questions in the second part of the briefing, please connect via Zoom. We will be able to take questions in Zoom only, and include your name and the media outlet title so that we can identify you as media representatives. Now, let me introduce our panelists today. We have, as always with us, Dr. Hans Kluge, our WHO Regional Director for Europe, and we have Dr. Catherine Smallwood, Senior Emergency Officer at WHO Europe. The scenario will be as usual. Dr. Kluge will start with an introductory statement, and then we'll take your questions. So, Dr. Kluge, without further ado, please, the floor is yours.
Good morning, good afternoon, everyone. This is more than ever pandemic times for Europe. But pandemic times do not necessarily mean dark times. Today, I will take you through the epidemiological situation, the way we look at it, how we can address it proportionally and timely, and what we should avoid. Let me start with the numbers. The fall-winter surge continues to unfold in Europe with exponential increases in daily cases and matching percentage increases in daily deaths. The evolving epidemiological situation in Europe raises great concern. Daily numbers of cases are up, hospital admissions are up, and COVID is now the 5th leading cause of deaths, and the bar of 8,000 deaths per day has now been reached. The region has registered the highest weekly incidence of COVID-19 cases since the beginning of the pandemic, with almost 700,000 cases reported. Confirmed cases have now surpassed 7 million, moving from 6 to 7 million cases in just 10 days. Over the weekend, new records were reached with daily totals surpassing 120,000 cases for the first time on both 9 and 10 October. Does it mean that we are back to mid-March? No, we are not. Although we record 2 to 3 times more cases per day compared to the April peak, we still observe 5 times less deaths. And the doubling time in hospital admissions is still 2 to 3 times longer. And in the meantime, the virus has not changed. It has not become more nor less dangerous. There are technical reasons for observing higher rates in daily contaminations, one certainly being the number by January 2021 from reliable mortality epidemiological models are not so optimistic. Higher than what these models indicate that prolonged relaxing policy save up to 281,000 lives by February 1 across our 53 member states region. Under proportionally more stringent scenarios, the models is reliable much more optimistic, yet with slightly higher levels of morbidity and mortality than in the first wave, but with a lower slope, as if we should rather expect a higher and longer swell instead of a sharp peak, giving us more reaction time. These projections nothing but confirm what we always said. The pandemic won't reverse its course on its own, but we will. A proportional and targeted response is the way forward. Measures are tightening up in many countries in Europe, and this is good because they are absolutely necessary. They are appropriate and necessary responses to what the data is telling us. Transmission and sources of contamination occur in homes and indoor public places, and within communities poorly complying with self-protection measures. So we need to be uncompromising with any locally adapted policy demanding for better self-protection and restricting situation of larger gatherings. These measures now in place or proposed are responses for what the situation is now, and they intend to anticipate any worsening situation. In brief, these measures are meant to keep us all ahead of the curve and to flatten its course. They are there to save lives from COVID without risking lives due to other diseases and due to economic despair. Any further escalation of measures would be the result of failure in complying with the preceding ones, and it is therefore up to us to accept them, while they are still relatively easy to follow, instead of resuming the path of severity, which many have tragically suffered from last spring. A question that comes to me with great insistence now is whether WHO Europe is for or against country lockdown. And let me be clear on that. I have repeatedly insisted in these press events that the pandemic today is not the pandemic yesterday. Not only in terms of its transmission dynamic, but in the ways we are now equipped to face it. Similarly, what we called lockdown 6 months ago is not what we would call it today. In March, lockdown was a shutdown, where every corner of our society and economy has been halted. No running business, no outing, no schools, no movement, and all borders closed. In March, lockdown was a default option because we were caught off guard. Today, lockdown means a very different thing. It means a stepwise escalation of proportionate, targeted, and time-limited measures. Measures in which all of us are engaged, both as individuals and as a society together, in order to minimize collateral damage on our health, our economy, and our society. Our message is that any nationwide tightening up decisions must consider both the direct risks and the collateral damage associated with the pandemic, such as mental health, for which we need to bring mental health care to the community and address stigma and misinformation, such as gender-based domestic violence, why we need to look out for each other and keep social services running, collateral damage on the students, and we should do everything in our power to keep the schools open, and we need specific policies in place for at-risk children with special learning needs or health conditions. Collateral damage due to rupture in the prevention and management of other health events, such as cancer, routine immunization, and cardiovascular diseases. Hence, we need a dual-track health system response. The economic vulnerability, that's why we need safety nets for everyone in need to cut the red tape and provide additional support services, including mental health. We need to take care of our exhausted health and other frontline workers. Survey, compensate them, act decisively. And all of these risks are to be closely monitored together with the COVID-19 data monitoring. We call upon governments and people alike to express empathy and engage in social dialogue, particularly with those most impacted by the restrictive measures, so that hope, engagement, and trust prevails among them. Thank you.
Thank you very much, Dr. Kluge. That's a very interesting statement. And actually, I have to tell you, it answers quite a lot of questions that we are receiving from the media, including for today's press briefing. So now we're moving on with the section number 2, answering question and answers. And let me just, very short intro. We will take, as usual, one question per person, and we'll do a round of questioning. And then, if time allows, we'll go for a second round. And I want particularly to thank the journalists who took their time to send out the questions in advance. So I have it in front of me, and I will raise them now as we move on. And I would like to start with the question from Sarka Nobilisova. Sarka, I can see that you are online and you raised your hand. So what I will do now, I'll just read the question as you sent it, and then if you have any clarification, I'll connect you later. So Sarka from the Czech news agency is asking, and I'm reading the original version. There is a sharp increase in COVID-19 cases in the Czech Republic, as well in other European countries. Would the WHO recommend to European governments to further tighten measures, and how? Should the European governments have limited gatherings in public and make distance learning compulsory as early as from September, when the school year begins? I'm looking now, Dr. Kluge, can you take this question, because it addresses all the countries in the region, not just Czech Republic? Go ahead.
Thank you. Indeed, from a European perspective, is it too late? It is never too late. But of course, definitely, we are concerned. So responses, what we always told, have to be adapted to the national and sub-national context. But in general, this is the time to step up the restrictive measures. As I was mentioning, with lockdowns as a very, very last resort, we know much better than in March what can and what needs to be done. I was quoting in my press statement that with measures such as generalized and systematic mask wearing in public and private places and strict control on social gatherings, reliable epidemiological models estimate that 281,000 deaths could be saved in 6 months in the whole WHO European region. So the key issue is that each time strict measures are being implemented, it is to avoid that more strict measures will have to be followed through. So it's a stepwise process, proportionate, targeted, and time limited. But definitely, this is the time to step up all of those measures based by epidemiological data, and the data not only based on the COVID figures, but as I mentioned, on all the other potential collateral damages from which the people and the economy suffered in March and April.
Thank you very much, Dr. Kluge. Now we have a question from Oskar Gorzinski from the Polish press agency. Oskar, I cannot see you online, but in the Zoom, but I hope you're following us on the social media channels. So Oskar is asking, in a number of countries, including Israel and to some extent Poland, school opening has been linked with recent rapid increases in the number of new COVID cases. Has a similar relationship been established with regard to preschools? Are there significant differences in how the virus is transmitting among little children, 3 to 5, and older one, school age? And I will ask Dr. Smallwood to help us with this question, if possible.
Thank you very much, Oscar, for the question. And as you rightly say, there have been linkages between schools, schools being part of our communities. And when the virus is moving between individuals within communities, they'll be moving also within schools, because schools bring people together. We do know that children are less affected by the disease, i.e. they're infected less, and when they are infected, they do have milder signs and symptoms and mild forms of disease. Our understanding of transmission within schools is still being developed. It's only now that since September and since the return of schools in over the summer period that we're really beginning to capture some of that data, and we're looking at that data extremely closely within the European region. We are looking at cases such as Israel, where there's clear correlations between some of these school outbreaks and community transmission. But we can't take it in isolation. There were several factors and that are driving transmission in different countries and in different locations within countries, and schools may only be one of them. We're also seeing other big drivers of transmission: universities, household settings, gatherings, public places, as the regional director highlighted. The issue here is, how do we deal with the fact that schools may be a location for transmission, but are also essential places for our children to be educated in. And our position has been that schools should be prioritized and kept open for as long as possible. And so that may mean making sacrifices in other parts of our lives in order to keep our children educated. So it's a very tough, complex situation. Every situation needs to be looked at very carefully. And sometimes school closures may be on the table where there is widespread community transmission. But as the regional director says, there are some measures that should be kept as on the table, but as a last resort. And we would certainly consider schools in that same category.
Smallwood, thank you so much. Before going to the next question, just a small remarks. I'm getting quite a lot of emails from you guys asking for the statement of Dr. Kluge in writing. Please keep in touch with our media team via the email that was provided in the media invitation, and we'll share it with you as soon as possible. So the next question, and if you allow me, I'll just go very quickly online, because I see Karen Wolfson from World Health Alert Crisis. She has informed us in advance that she wants to raise the question. So Karen, I'll give you the floor now. Please unmute yourself.
Hello, can you hear me?
Yes, please go ahead.
Good morning. My name is Karen Wolfson from World Health Alert Crisis. The official Public England data from the government shows categorically that COVID-19 cases, positive ones, rocketed in 10 to 19-year-olds since schools were reopened in September, much, much more than any other age group, from 10 in 100,000 in August 2020 to 250 in 100,000 by the beginning of October. So that's a very high amount. And despite, that is, the fact that testing was almost impossible in the UK as well as around the world and in Europe, children are rarely tested, and which makes the plight of children disappear from the data. And children have no right of reply. they have no unions, and their parents, the majority, who are not the wealthy and powerful parents who want their children at school, but they are the...
Karen, I'm very sorry. Can I just ask you to shorten and to go straight to the questions?
And well, my question is, why are children being subjected to a herd immunity approach when we actually know that they can get ill? It's not a mild disease in all of them, and we have no idea how many of them end up in hospital because there's a lot of misdiagnosis.
Thank you very much, Karen. Thank you so much. So we'll just try to answer your extensive questions. I'm looking at Dr. Smallwood. Can you please help us, Dr. Smallwood?
Thanks. Thank you, Karen, for the question. And yes, thank you for quoting some of the numbers around children in the UK and in England specifically. I think when we look at the age group from 10 to 19, there are significant differences also within that, and these need to be taken in. Certainly among 16 to 19-year-olds, the older children, we do see transmission that looks more like what is seen in younger adults. And that's certainly borne out in the UK with the large university outbreaks that we've seen over the past few weeks as students have gone to university for the first time or are returning to halls of residence. And that's where we do see conditions where younger individuals are living together, socializing together, and the disease, the virus is able, and the conditions are there for the virus to spread. Yes, of course, children do have disease. WHO's position, and the position I think I understand is implemented in most countries, is that all suspect cases of COVID-19 are tested. This does not set them aside or treat them any differently to other cases or adults that are showing signs of disease. It may be that less testing takes place because there are more milder courses of the disease, and many children may be positive or asymptomatic and may not be demonstrating signs of illness. So all of these things need to be taken together. Certainly, we do need to look at the transmission within children. We do see deaths among children, especially children who may have other vulnerabilities. They are not taken to be different from anyone else in our communities. Thank you for the question.
Thank you, Dr. Smallwood. Karen, if you still have any other questions or something, please keep in touch by email. We'll try to answer all the aspects that you raised today. We're moving on with a question from Sara Kovac. She's from the Slovenian Press Agency. Sara sent us 3 questions, so I'll start with the first one in the first round. How do you evaluate the current restrictions in European countries are taking in order to stem the rising infection? Are they sufficient? To what extent the governments, in your opinion, follow the recommendations by scientists and health professionals? This is a very important question I would like to address to Dr. Kluge.
Right, thank you, Sarah. So it's a time to step up the measures. We learned a lot from the first time around, and what we saw is wherever and whenever the policy response was prompt and drastic, the response was effective. But the virus has also shown merciless. Whenever there was delay, partisanship, disinformation, or denial. So a lot is in our hands, in the hand of the governments and the hands of the people. Again, this is to be contextualized, but if you look at the average, as I was mentioning in the press statement, overall, we are indeed concerned, and it is the time to step up the measures, but again, in a gradual way. And some countries, of course, which are at the top epidemiologically, have to go much more further than the other ones. But we should not hold back. So the key message here to the governments is, do not hold back with relatively smaller actions in order to avoid the same very painful and damaging actions we saw in the first peak round.
if you allow me, can I follow up with the questions from Konstantinos Davanis from the Hellenian public television in Greece? Actually, something very much linked with what you just mentioned, and the question is about fatigue. Konstantinos is asking, fatigue from the pandemic is now evident throughout Europe. False news, conspiracy theory, and vague state instructions have confused citizens. How can this situation be reversed, and how can citizens be aware of the immediate danger they face if they do not comply with the measures? Citizens give the impression that they are living in a movie. Dr. Kluge.
Yes, these are indeed unprecedented times, definitely. 2 weeks ago, the office here convened a meeting with the chief medical officers of all our member states exactly on this topic, on pandemic fatigue, because our survey in 27 countries showed that in some countries up to 60% of the people are really tired, fatigued of the restrictive measures. And we have presented a policy framework to help countries to address this pandemic fatigue, which maybe is the number one challenge that we are facing today. So a number of points here. The first one is to keep the finger on the pulse, know what's living in the communities. So instead of pointing the finger, gather the data. And this is ongoing in many, many countries, whether the West or the East. The second then is based on those data to engage the communities. In a number of countries, the teachers, the students are being asked to co-design measures how students can go back to the schools and the universities in order to keep those open. So to co-create solutions with the voice of the community, and particularly influencers, youth influencers, is very, very important. Ultimately, it's about new, innovative ways to be happy, to be social. And it's amazing how many creative solutions there are. We also know this a bit from the vaccination times. So there are different strategies, but one size does not fit all. And that comes back to where I finished the press brief this morning, the press statement. It's empathy. It's very important to show empathy. Yesterday, President Macron in France, when announcing more tight measures, was telling it is hard to be 20 in the year 2020. To show the leadership showing empathy and engaging in social dialogue, especially with those people hit most hard, is very, very important.
Thank you very much, Dr. Kluge. Now we have a question, I think, for Dr. Smallwood, also from Konstantinos. He's asking about the winter season. Winter is upon us, and both the flu and the coronavirus will potentially cause major problems in the health system. There is a lot of debate about who should be vaccinated against flu, especially with the question of whether all children should be vaccinated, as cases in school increase dangerously. So I would like to ask you if all school-age children should be vaccinated, or if they should only be vaccinated in high-risk groups. Dr. Smallwood, please advise.
Thank you, Luba. And yes, to answer the question and to be very specific, I think the question around influenza, i.e. seasonal flu, is addressed at who should be vaccinated, not for COVID vaccination, as I understand. We are not, as far as I understand, yet seeing increased circulation of influenza in our children's populations associated with schools. That just something I wanted to clarify before answering the question. In terms of how countries should prepare for the flu season, yes, absolutely. Flu certainly has the potential to add major complexity to our response systems, both in terms of managing COVID-19, but also in terms of adding an additional layer of burden on our already stretched health systems. So the current advice that WHO has is twofold, and I'll just highlight two aspects of this. One is continue to monitor flu circulation in your populations. Do not forget to look for the virus, keep a very close eye on it, and let's hope that the flu circulation, the flu virus circulation remains low as it has over the summer and as it has in other hemispheres at different seasons. Second, we need to prevent circulation of flu, and vaccination, of course, is a very key component in preventing seasonal influenza circulation. WHO's current guidance, based on its scientific advisory group, is that vaccination programs should continue. So that means that specific at-risk groups for influenza that are different than they are from COVID should continue to be prioritized. For influenza, those at-risk groups, of course, include pregnant women, they include children, they include people with comorbidities, and especially during COVID season, they will include healthcare workers. And where there is any shortages in influenza vaccine, that the priority really should be given to both the older age groups and to healthcare workers. When it comes to children, and where countries have influenza vaccination programs that target children, those should also continue, because we know that flu can be particularly severe in children, especially those between 2 months and between 6 months, and 2 years old. But the age groups for children should continue as they usually do for influenza vaccination. Thank you.
Thank you, Dr. Smallwood. Just making a point to where we are right now. We're at the midpoint of the press conference. We have 6 journalists waiting for question online, and thank you guys for bearing with us. We still have one question submitted in advance, and it's about e-health from Nonette Kozobon. She is from the European Security and Defense Unit, and Nonette wants to ask Dr. Kluge this question. Has digitalization in the area of healthcare, especially during the COVID-19 pandemic, proven to be useful? And do you see critical issues, for example, with regard to the data protection? Do you think that our societies in Europe are ready to use the full potential of e-health? Dr. Kluge.
Question very close to my heart, because digital health and innovation is one of the 4 flagship areas in the European Programme of Work 2020-2025, which was adopted by the 53 member states, the mid of September. So the answer is yes, absolutely, but also before the COVID-19. There are a number of, what I would say, P's here. The P from paradigm shift. The e-health and digital health is really helping for a paradigm shift in 3 more P's. The P of people, to have a health system where we put people in the center. And the digital health helps to connect these services around in the continuum of care. So to make it for the people easier. The second P is of professionals, that it empowers our health and social care professionals to have a connected file with data. And the third P is of prevention. For a long time we talk that the health system has to be better balanced between curative care and prevention and promotion. But we also saw in the COVID times another 2 P's which are challenges, and one you mentioned yourself is the P from privacy, and the other P from poverty, digital poverty. And that is where WHO has the comparative advantage to ensure that during implementation of innovations, we leave no one behind. And we have a lot of very good examples, but a lot of work to do on what we call the governance. Final point, it's only a tool, because now it seems that digital health becomes almost a goal in itself. It's a tool for better health and well-being, and that means that if we don't have the data, the basic data, whatever tool you have is not going to work. So we cannot see the digital health separate from strengthening our basic health information systems. Thank you.
Thank you, Dr. Kluge. Now we go on with our reporters online, I see. I'll give the floor one by one, guys. So in order of the list. So first we have Ismir Milovic from N1 Bosnia. Ismir, can you unmute yourself, please?
Hi, can you hear me?
Yes.
Okay, so my question is practically in line of what Dr. Kluge have said at the start of the press conference. The current picture is pretty dark when it comes to the numbers. So my question is, how do you see situation in the Western Balkans? Because all countries here in the region are recording the highest numbers since the pandemic started. We are small countries, but when a country such as Croatia records 750 cases a day, that's a huge for us here. So what is your current view of the situation, and what should we expect in the future if the numbers continue rising as they are rising at this moment? Thank you so much.
Thank you, Ismir. I'm actually looking at the moderators. I would like to ask both of them to comment because there are general messages but also more technical ones. Dr. Kluge, do you want to start?
Right. With maybe the sub-regional approach, we do have regular video conferences with the West Balkan and time to time with the Central European Initiative, which combines EU countries neighboring and the West Balkan, because no one is safe until everyone is safe. Absolutely, this is a matter of concern. So it comes back to what are the basics? Because remember, the virus has not changed and the basics still stand. We need a strong leadership from the country, from the government, with a strong risk communication. Communication has to be based on data, on science, and has to be clear and consistent, and has to include some concrete action points, and again, express empathy with the people. This is for the government. And then for the people, our behavior will determine a lot how the course of the pandemic will go forward. And we know what needs to be done. And before we go to very painful measures, there are some straightforward measures which I mentioned, like, for example, the systematic and generalized mask wearing, strict control on social gatherings, and then it can be scaled up. Teleworking in many instances, unless it cannot be done, is another one. So there are several measures which need to be scaled up. The good news is, if those are strictly adhered to, in a couple of weeks, we can see a result. But if it's already far advanced, then we also need more measures. For example, definitely, we know that the hospitals have to be prepared. The intensive care unit capacity has to be prepared. In countries, a number of countries which more, let's say, in the first wave successfully managed, we know that the primary healthcare was involved to unload the pressure of the hospitals. And here I would like to come back to a strong plea and a strong appreciation for the health workforce, the social workforce, but also all the other frontline workers who keeps society running. We cannot risk that they will have a burnout, which is a very realistic scenario, because many of those people have been working around the clock, including the teachers. Great appreciation for the teachers. So we have to be, as a government, as a society, appreciative and work out measures to protect the gold of the response, which are those frontline workers. Thank you, and over to Katie.
Thank you, Ismir, and I fully echo the regional director's comments. I think he said it all, and really going back to basics is something that I would also highlight. The other thing I would highlight is learning from the 10 months or so that we've been in this pandemic and not repeating past mistakes. So here there's a lot to know, to recognize. We are not where we were in February, March. We have learned a lot. We know much better where the virus is circulating. We know much better how to treat patients, even if we don't have a specific treatment that we can give to everyone. We know how to provide oxygen. We know when to make changes, and we know how to keep people out of intensive care. These things are essential going forward. The other component is essential health services. We do know the major disruptions that we had in February, March, April. We can't afford to let them happen again, and we have to continue our systems of essential health services going. And we need to do that by protecting them from infection, so protecting our healthcare workers from infections of COVID-19, but also keeping mechanisms in place for referral and innovative solutions to make sure that other chronic diseases don't suffer because COVID is taking over our hospitals. And that's a really key message. The other component here, and that's just what I want to end on, is keeping the infection out of our most vulnerable groups. As the regional director said, our death rates can be kept low if we make sure that we protect our most vulnerable. And there have been increasing instances over the past few weeks of outbreaks occurring once again in long-term care settings, such as nursing homes for our older age groups. Now, we need to avoid that from happening, and that's something that the Western Balkans has put a lot of attention on and will continue to have to do over the winter period. Thank you.
Thank you very much, both of you, for these strong and very clear messages. We're moving on with Jeremy Lange from Radio France Internationale. Jeremy?
Yes, thank you for taking my question. Just a quick one. According to a Geneva epidemiologist, the very small particles, up to 70% of all contaminations could be due to those really small particles. Like I'm talking about the airborne transmission. So I was wondering if you have any comment on that. Do you think that it could actually explain why Europe is actually in this situation? Thank you.
Merci, Jeremy. I hope Dr. Smallwood can take this question. Dr. Smallwood?
Thank you, Jeremy. And I can't comment on the specific epidemiologist that you're quoting because I'm not quite sure who. But of course, the aspect of transmission of COVID-19 is something that we continue to look at, and we continue as an organization to compile all relevant research and to look at it in a holistic manner. And we do update, and we have in the past, as you all know, updated our technical recommendations based on how we learn about the virus. Currently, we do know and we do believe that in certain closed or confined settings, there can be transmission of COVID-19 through an airborne route, and our recommendations match that knowledge of the science. But it comes down to proximity and duration. That is what drives transmission, and that is what we need to look at in terms of how we provide recommendations both at the individual level and also at the community and at the government level. It comes back to those simple things of respiratory etiquette, wearing a mask where appropriate, washing our hands, and maintaining a good, safe physical distance, and avoiding closed or confined spaces, whether they are in our homes, in private parties, in public spaces. These are really simple rules to follow, and they don't cost anything at all. So if we do that, we can really make sure that we prevent transmission of all types and forms, because we do know that there are different modes of transmission, and we just need to apply these simple measures that are universally true.
Thank you so much, Dr. Smallwood. The next question comes from Russia, from the online news platform news.ru. Igor Kanavin online. Igor, please.
Hello?
Yes, can you hear us?
Hello? Yes, I can hear you, and can you hear me?
Yes, absolutely. Go ahead, please.
So thank you so much. My question is, what can you say about the situation with coronavirus in Russia? Unfortunately, the number of cases is increasing and has already reached record levels. Do we need serious new restrictions in our country to stop the spread of the virus? And what can you say about the efficiency of the Russian coronavirus vaccine?
Thank you very much, Igor. Can I take the advantage of a recent visit you, Dr. Kluge, had in Russia to start answering this question by you, and then probably Dr. Smallwood can add some figures. Please go ahead, Dr. Kluge.
Spasibo большое, Igor, for the question indeed. 2 weeks ago, I had my first official visit to the Russian Federation as the region director, and it included field visits after a meeting with the Prime Minister Mishustin, the Minister of Health, Mikhail Albertovich Murashko, and then Rospotrebnadzor, Anna Yurovna Popova, and also the Minister of Foreign Affairs, Sergei Lavrov, and the Mayor of Moscow, Mr. Sobyanin. I went to a telemedicine center even in Moscow to look how the healthcare workers were managing thousands of COVID-19 patients with mild or no symptoms, and also the volunteers who took the Sputnik V vaccine through telemedicine, which was quite impressive. I mean, we're now documenting this experience. What was very positive as well is the fact that the healthcare workers are getting compensated also with insurance. This is something that is definitely a practice that we are promoting, and economic support. In fact, the Russian Federation was one of the first countries who provided microeconomic support. And yes, it's true that not only in the Russian Federation, as I was telling many other countries, the cases are on the rise. And it's always a delicate balance in any country between protecting the health of the population, the social and the economic consequences, what I call the collateral damage, and the well-being of the people. But I saw, for example, in Moscow that the measures were being tightened as well, and we're now working together with the Institute of Health Metrics and Evaluation to also work together on projections. On the vaccine, as I was mentioning also in the media and to TASS, so the Russian Federation has a long proven track record of vaccine manufacturing, development and uptake. I think, for example, on poliomyelitis, on smallpox, on yellow fever. So all the capacity is there. The phase 1 and phase 2 results were published in the Lancet. But as with any other vaccine, of course, we need to wait till we see all the data for the phase 3, which is when many more people get the vaccine, and particularly the safety is being measured. So I am very grateful to the Russian Federation for these efforts, particularly that the government was telling that there will be, in case that the vaccine would be WHO qualified, that then there would be the principle of solidarity also for other countries, which is very, very important, because that's something I'm concerned, namely access to all countries to a COVID-19 vaccine in the WHO European region. So we need this solidarity very much. I'm very, very extremely appreciative. But of course, like any other vaccine, we have to go through the phase 3 to make any definite results. Data are being shared with WHO, so the process is going on.
Dr. Smallwood, anything to add on the technical part?
Just to add on the epidemiologic situation in Russia, I mean, Russia is a vast country, and what we have seen is quite significant differences at different levels of the country. So yes, indeed, since early October, there's been a very significant increase in cases. Those have been really concentrated, and of course, this is something that we take very seriously around the capital cities of Moscow, the greater Moscow area, and of course St. Petersburg. At the same time, and this is what we would expect to see and will have an impact on the transmission, we've seen measures being taken in those settings. So we've seen designation of more hospital beds for COVID, we've seen preparations made at the health facility level, and we've also seen new measures being implemented in terms of asking people to work from home, taking advantage of school holidays to ask people to take individual measures, and then more restrictions on the occurrence of gatherings in public places. So we have seen impact on the health system. We've seen responses from the local authorities, and we expect to see an impact on the epidemic curve due to that.
Thank you, both of you. And we have the Swedish Svenska Dagbladet. We have Gunilla von Hall on the call. Gunilla, can you hear us? If yes, please unmute yourself.
Yes, I can hear you. Can you hear me? Okay.
Go ahead.
Look, my question is, to what extent is the spike we're seeing now, to what extent can it be explained by this massively improved testing capacity? Are we seeing the same spike in hospitalizations, intensive care patients, and deaths? So in other words, I mean, we're seeing it's increasing, we have more, but is it also getting more serious compared to the spring, to March? Thanks.
Thank you very much, Gunil. And I can see that Dr. Smallwood wants to take this question. Please go ahead, Dr. Smallwood.
I can start, and perhaps the regional director would like to add a couple of points. But Gunilla, I think it's not a simple yes or no answer. It's a question of both things that you say are true. Are we at the same spot as in February, March? No, as the regional director said. We are seeing, in terms of numbers, pure numbers, very significantly higher numbers being reported. But we, as I've said before, we need to look beyond those numbers now. They don't tell the story on their own. In terms of testing, in the month of September, we saw 4 million Europeans tested for COVID-19 each week on average. That's more than double what was seen earlier this year. So yes, we are testing more, and we are capturing a much more significant proportion of the overall numbers of cases. So comparing what the curve looked like in March to what it looks like now, it's really comparing apples and pears. Now, on the other hand, when we look at hospitalizations, we need to look at both things. One, total numbers. If we look at total numbers, no, hospitalizations are still much, much lower, less than 25% of what they were in the earlier months. However, if you look at the trend, that's what we need to focus on. And the trend is going up week by week. And what we already see is in some cities across Europe that hospitals are coming under strain, that intensive care units are again coming to be more than 90% occupied, and the greatest proportion of patients within those intensive care units are increasingly COVID-19 cases. These things change very quickly. Hospitals will fill up very quickly, and we don't have the luxury of time. So we need to take action early to prevent people from ending up in hospital, to keep our infections among vulnerable groups as low as possible, and keep our health systems going, keep all components of our health systems going. Thank you very much.
Yes, thank you. And actually, yeah, I'm glad we're done with this question, because we still have 4 or 5 minutes left. So we'll take the final question, and it will be from Maria Cheng from Associated Press. Maria, thank you for joining us today. Can you unmute yourself, please?
Yes, thank you very much for taking my question. Can you hear me okay?
Yes, absolutely. Go ahead.
Okay, great. Thanks, Luba. So my question is related to this, to what Dr. Kluge said in his opening statement about this exponential surge in cases we're seeing. How much of that can we attribute to mistakes made by governments and maybe releasing their lockdowns too quickly, as WHO did warn about doing that too quickly without having the proper testing and tracking systems in place? I mean, was it sort of foolish for countries to encourage people to go back to work, to travel, to go out and eat without having these systems in place? And how damaging do you think these U-turns are, that people are told, go back to work, go travel, it's fine, but now we are entering, another lockdown period?
Thank you very much, Maria. I think we have two aspects to this question, actually. There is one general and one technical, and I would like both our experts to say something on that. Please, Dr. Kluge, can you please start?
Yes, I would say straightforward, it's a balance, it's a mixture, but the situation was not sustainable. Like we cannot have a lockdown which in March was a shutdown indefinite. So the pressure and the collateral damage on the people was too much. It's again, two words here I would like to repeat: proportionate and targeted. And I think that's what needs to happen and had to happen. We did publish at the time a policy framework how to transition out of the lockdown, and we are now in the process of updating it, because it still remains the same. It has 4 considerations: epidemiologically, your health system capacity, the people behavior, and the micro and macroeconomic consequences with in-between data and communication. So it has to be done in a comprehensive approach, but not from zero to nothing. That's true. It has to be in a gradual way, and it's like cycling, a little bit forwards, a little bit backwards, because we will have to live with the virus still for a while. So it is finding this balance. If very strict measures are to be implemented, and in some cases in Europe this is the time to do it, then the key issue is to take those couple of weeks to beef up, as you say, the test, track, trace, isolate capacity, to take really advantage of those tough times to beef up the capacity. Thank you.
Dr. Small, anything to add to this?
Only to add, Maria, that yes, you are right. Our systems are by no means perfect, and there are major differences across different countries, of course. Contact tracing and testing are cornerstones of this, and our recommendation is that, as imperfect as they may be, countries need to continue to implement them. And even as the swell of cases occurs, we need to continue to try and test every case, identify and trace all contacts, and continue with those. Then the importance of swift, decisive, and clear implementation of measures. Of course, as situations change, so will the measures that need to be implemented. And this comes down to very clear messaging from authorities, from governments, both between different levels of government, but most importantly to the public. And of course, your question alludes to confusion among people on what they should or shouldn't be doing. And of course, that's something that needs to be managed. We don't have the luxury of time. Decisions do need to be taken on the basis of the facts that we have, and they do need to change. But those changes do need to be coherently communicated.
Dear moderators, can I ask you forgiveness and ask you for an extra minute of your attention, because I see Isabel Ewing from Hungary in Budapest, and she's a journalist who is following very closely our press conference. I want to give her the floor. Is it okay with you? Isabel, go ahead, unmute yourself.
Thank you. Thank you very much for getting to me finally. Can you hear me?
Yes, very well.
Thank you so much. I just have a quick question for Dr. Kluge. Now, you've mentioned that lockdowns are a very last resort, and that governments should begin with smaller, more targeted actions. What about measures like circuit breakers, like what Wales has just implemented? Is that a proportionate measure to you?
Thank you. I know this is being debated. Let's say, comes back a number of points here. First, if it is implemented, then the time has to be taken to further develop the basics, as Katie was telling, the test, track, trace, isolate. So really to take the advantage to get the basis in order. Number two, to do it indeed time limited. But maybe the most important point is that it's not, again, a panacea. It cannot be taken in isolation, because if the people suffer this hardship because of that measure, and then it is lifted, and then the people, for example, would not adhere to the basic public health measures, then the effect will wane very quick. So it has to be seen in a comprehensive approach, and if it is implemented, definitely we need to have to look at the dashboard of the potential collateral damages to protect the mental health of the people, the economic health, the students, etc.
Thank you, Dr. Kluge. Dr. Smallwood, nothing to add. So we now can close our press briefing. And thank you very much, our panel experts. And thank you very much for you, dear journalists, for joining us today. One very short note before we switch off. The statement of Dr. Kluge will be published on WHO European website as soon as possible. If you need an earlier version, please contact our media team at eupress@who.int. The video clip of this, the video of this press briefing will be posted on our YouTube channel, probably in a couple of hours. Again, if you need an earlier version, we'll try to help as much as possible. Keep in touch with us by email.